Now, monkeypox has been detected in close to 70 countries around the world. Confirmed cases here in the US have topped more than 1,800, although the true number is believed to be higher. Health officials have been unable to meet the increased demand for vaccines in places such as New York City, which is the epicenter of the outbreak in the US. Well, for more, I'm joined now by Harvard Medical School Professor Dr. Ali Raja. Doctor, thank you very much indeed for joining me. While saying that we should be taking this more seriously, officials, Centers for Disease Control on its website says that monkeypox is rare in the US and rarely fatal. So why should we be so worried about it?
It's a great question, Jane, and thank you for having me. And the fact is that every day in the emergency department, I have patients who come in, and given our experience with COVID, they already have a predilection to being concerned about infectious disease. And I get asked every day how worried we should be about monkeypox. The fact is, we need to be aware of the disease so that we're on the lookout for it. If we have patients or if we know family members who have a few days of a fever and of lethargy and muscle aches and then develop that characteristic rash, well, we need to make sure that they are then quarantined and that they contact their doctor to arrange for testing. So we all need to be aware of it, but it's not spreading at a rate that we need to be very concerned about. And as you just mentioned, it has a case fatality rate that is exceptionally low. And so it's not the kind of thing that is causing a lot of people to get very, very sick.
You seem to be playing down the risks of it a little bit. But I have to ask, we have had a lot of practice in the last 3 years with COVID. It seems to me that we're still not very good at detecting these infectious diseases or controlling them. Is that fair?
I think that's fair, Jane, and we only have to look to COVID, as you rightly pointed out, to find evidence of that. COVID, however, is very similar to a number of other diseases and spreads via aerosolized contact very easily, especially in indoor spaces. What we know about monkeypox is that it really does require some sort of direct contact to spread, where a break in the skin, oral contact, touching a lesion. It's probably not aerosolized. And so since we know that it's spread by social networks, it allows for contact tracing and it allows for vaccination of those networks around a close contact. I don't mean to downplay the risk at all, but it is much more containable than something like COVID is.
So what do you recommend that people do to protect themselves? Should people get a vaccine?
It's a good question. Now, we have a large stockpile of vaccine, tens of millions of doses, but it's really not enough to vaccinate the entire country. And the primary vaccine we are using is an older vaccine that can have significant side effects in some people. So the key to using the vaccine is really going to be doing so strategically, using it for people who have direct contact with a known case of monkeypox or at high risk of someone with monkeypox being in their social network. And when we use it strategically like that, and remember, it's not just one dose. The CDC is now recommending 2 doses spread 28 days apart. When used strategically, we can hopefully vaccinate the high-risk populations that are in the social groups that are getting monkeypox right now to contain it as quickly as possible. But for the run-of-the-mill patient who doesn't know anybody who has monkeypox, hasn't been in contact, isn't at high risk, we don't need to vaccinate that population just yet.
Dr. Ali Raja, thank you very much indeed for joining me.